So when you say obesity is a risk factor for something, we are actually just saying is that if somebody has this condition, then you have a higher likelihood of getting a certain condition. It doesn't mean that one is equal to the other. So
in fact, some doctor told me in Kenya it's partly eastern and central province, not western.
No, I wouldn't say that. I actually have practiced. The good news is that I've practiced in Moi teaching and referral, and it's on Western Kenya, and it's there. A lot of it actually. Yeah. So what I would say is that we would like our men to go for early screening, and especially if you have a family history of prostate cancer, especially for someone who's had prostate cancer before the age of 50 in your family, then the men within the family, it's important for them to start screening early. So it's something that we know we are already at a risk. Say for instance, even breast cancer. Breast cancer, on average, globally, 1 in 8 women in their lifetime will develop breast cancer. But then we don't really have women who are regularly going for breast cancer screening. And obviously part of it is because they don't know the knowledge about it, but also part of it is the cost associated with it. If you are going to do a mammogram, for instance, for screening, it will cost you anywhere between 4,000 and 10,000 shillings, depending on where you are going. Most of our population cannot afford. Yet you know for sure is that if these people were screened, even if the government had a program in which we can do screening, subsidized screening, both cervical and breast screening, we will really avoid potentially having people that we need to treat with radiation, with chemo and whatnot in the future. So these are some things that can be done within the ministry and the government, and obviously working private-public partnerships to ensure that it happens.
Let's talk about you know, the fact that it's important to have early, you know, detection. Yeah. How did you go about it, and perhaps your message to people out there, even as we celebrate or mark the World Cancer Day next month?
For me, it was quite interesting because mine developed on the left side of my neck, but it was behind my neck. So chances of me seeing it was close to nothing. For me, it would be more or less of like me feeling it. But I was young. I was a teenager. But at that particular moment, I was actually staying with my auntie. She's the one who noticed the lump. And it was very abnormal because it wasn't painful, and it was more or less of like it was playing around, because when you actually press the lump, it would, you know, go in, then come out. And to her, it was more or less of like I got hurt at school, but I wasn't. What I can actually tell people and anyone is, one thing is that you can get diagnosed with the disease, and there is no specific diagnosis. It can be exposure to radiation, it can be, you know, chemicals that we use on a daily basis, it can be fat. For my experience, I was having a lot of, you know, fries and all. So it's healthy eating, and do not ignore changes in your body. When you feel a lump, when you feel, you know, a bit different, seek professional advice, because as Daktari said, the moment it's detected early, the chances of you going through medication and, you know, being declared free like me are higher, rather than just ignoring it and just, you know, sticking with it. Yeah.
Why are people going to India for breast cancer?
That's a very interesting. So I'll preface this by saying that actually 90 to 95% of the cancers we see in our setting here, we can actually comfortably treat them here. So one of the major problems that we have, and part of it is our own health professionals, as oncologists, we are not, or even as physicians in Kenya, for instance, we are not working in a multidisciplinary setting to know what we have within our close reach so that we can do this. Because cancer is not managed by one person. The nurse, the nutritionist, the physical therapist, the oncologist, the surgeon, they are just as important as the other person within the team that manages a cancer patient. So part of the problem, there has been several pushes about going to India. One, there are obviously some insurance companies that tell you that we'll, you know, once you get our insurance cover, we can send you all the way to India. Two, because India does quite a little bit of marketing around here to tell people that you have this, we have the best hospitals here, and we can treat you. Two, is because when a cancer patient has gone through so many places and they are not really getting answers, I always advise my cancer patients to always seek second opinion. Because sometimes they've gone to several doctors and several healthcare facilities, but nobody is putting everything together that is explaining their condition. So they always feel that in India, they'll get better care when they go there. But I can tell you for sure, other than bone marrow transplant, for instance, that we are not offering in the country right now, or a few other tests that we may not necessarily have most of the cancers that we can manage them very actively and here.
So are we sloppy? Because I know a friend of mine.
We are very sloppy.
Exactly, because a friend of mine, his wife was diagnosed with breast cancer. He took her to India. They went to India, they examined it, come back home. There's nothing like that.
Yeah.
Why is that so?
So that is a very good question too. So the same way I've said, we have very few professionals in oncology and whatever, and surgical oncology and radiation. We also have very few professionals in pathology that can actually be able to diagnose cancer. So what happens is that the general training in our pathology institutions is still pretty much how it has been, like it was in the US several years ago, where they are trained to be generalists. So the same pathologist that you are giving a slide for malaria, you expect the same pathologist to be reviewing your slide for a mass that you've sent to them. But you know, this actually requires some specialized training. The pathologists, for instance, at Moi Teaching and Referral, we've actually enabled them to have several sessions with various institutions around the world, including Indiana University, Brown, and University of Toronto. So now, if you have what we are suspecting to be a lymphoma, we have a specific pathologist who actually has been trained to read lymphoma slides. So this actually helps in good diagnostics. Second thing is that a lot of patients, when we come to diagnosis, they do not want to spend the extra money quite a number of times, and probably they have not been educated well, because number one to controlling cancer is actually proper diagnosis. Nobody should be able to tell you you have cancer without taking a tissue and evaluating it very well to know that it's cancer. So we have patients where you tell them that I'll remove this mass and I'm going to test it, then they say, how much are the tests? You say the tests are anywhere between 10,000 and 20,000 shillings, and they said, is that part of the treatment? And you say, no, 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 it's just for testing to actually confirm which type. Then they're like, if it's not treatment, then I don't really want that. I just want you to use the 20,000 to buy the chemo for the treatment. You see, you're actually really going against what we need to do. What we need to do is to be sure with 100% certainty that this is the cancer and this is the type of the cancer. Because even when you have, for instance, I'll give an example, even if you have lung cancer, there are several types of lung cancer. There's small cell lung cancer, there's non-small cell. And in non-small cell, there are more than 8 to 10 different types of non-small cell. So it's very important for us to really examine and know which one you have, because the treatment choice, or the drug that we'll use, or whether we'll send you for radiation, or whether we send you for surgery, is actually dependent on the histological type of the cancer. So it's important for someone to say, when you hear Dan's story, you don't come and say, oh, Dan had radiation done, why am I not starting with radiation? Know that it's different cancers call for different kind of treatment. And also, even within those cancers, the stage of cancer, like if I had a patient with Hodgkin's disease, and I have several that I'm treating currently, and they were stage 4 Hodgkin's lymphoma, I would start them with chemotherapy, which is the standard of care, not taking them to radiation. But it depends also on the stage in which the patient is. So I think part of what you said, we are a little floppy. We are not organized in terms of a good disciplinary approach to care. And when they go to India, they find this center where all these doctors are talking together, and a patient feels, wow, you know, there's a palliative person talking to you, there's somebody, and all of them are in agreement. While here you'll find some doctors telling you, oh, you have cancer, you're going to die in 2 days or 1 week. So then you realize, and then they come to me and I tell them, no, 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 that is really not true, because this cancer can be treated this way. So you find a lot of healthcare professionals themselves are not really aware of cancer and its diagnosis and treatments. In medical schools in this country, for instance, very small proportion is geared towards teaching people on how to properly diagnose and treat cancer. They still have the system where there's a lot of infectious diseases and other diseases in the system, but the cancer which kills a lot even here in Kenya is really not taken care of.
All right. Yeah. Perhaps as we wind up, just briefly your final remarks, even as we wait for the World Cancer Day. Just
Which day is this?
So the World Cancer Day is a day that is recognized worldwide. And we celebrate and actually try to really focus on diagnosis, early screening, and as well as proper treatment of cancer patients and also survivors and their families. It's celebrated on the 4th of February every year, so this year we'll be celebrating on the 4th of February. And at Moi Teaching and Referral Hospital in Eldoret, we've lined up several activities as part of marking this World Cancer Day, which includes screening and also doing a lot of biopsy for diagnosis for patients who present with masses, but most importantly, educating the masses as well as healthcare professionals on cancer treatment, cancer prevention, and cancer care. The only other quick point I would say is that Moi Teaching and Referral Hospital and Moi University have actually gone a little bit of a step further in training for cancer professionals. We are the only center in East and Central Africa right now who are training professionals called gynecologic oncologists, and they are currently in their final year of studies, the first class. And then we are also training clinical officers for higher national diploma in cancer management. So these kind of things, and if University of Nairobi joins forth and other private institutions, will ensure that cancer will actually be manageable, and we shall be able to reach the levels at which we see in the US and other first world countries. Because I always say, when I sit in front of a patient here in Kenya and I'm talking to them about the options of care, it sometimes hurts me to know that they may not really necessarily have the same outcomes as the outcomes of the patients in the US. That you sit with the same cancer, with the same stage. But all these things, we can actually make them happen. And honestly, it doesn't require as much investment as everybody always keeps saying.
All right, just quickly, just looking at some of the questions, concerns coming in. This is Jane says, please, where can I go for free cancer screening? We have another one says, my son has a lump in his testis. Can it be cancer? Another one says here, can really cancer be cured? My mother has breast cancer. She went for an operation last year, April, completed a chemo, and now waiting for radiotherapy. Imagine she's to see a doctor in September. She's so worried and says that she's feeling it in her heart. Can we get help from Dr.?
So I may actually start with the last question. Honestly, one of the things, and this is part of the reason you asked me about why do people go to India. Delay in diagnosis, delay in care, delay in treatment. When you delay care for a cancer patient, it's actually you've denied them their life. Because even when you start treating them when they're stage 4, it's not the same. The time when they came to you 8 months before, they probably were stage 1 or 2, and they were potentially curable, or at least treatable to the point that their outcomes are very good and they're almost closer to the general population. But then when you delay care, we say, I see you today, come for chemotherapy in 2 months' time, come for this radiation in 8 months' time. Then this patient actually, it's poor care. And that is poor quality of care.
But what can you do if you're at Kenyatta Hospital and there are thousands of them and
the
place is booked?
I totally agree. And
so
I think this is where I'm not the right person to answer this question, where the Ministry of Health and especially the Division of Non-Communicable Diseases need to be put on the spot a little bit, in the sense that they need to help coordinate this. Because our public institutions, especially national hospitals, it's KNH and Moi Teaching and Referral, where these patients actually present. So it's important, and doctors are here. There are quite a number of people, and we can do these trainings to ensure that doctors can review the patients. So the question about screening, at Moi Teaching and Referral Hospital, we have screenings that we've been doing for the last 6 years, and even before. Right now, we've screened well above 28,000 women for cervical cancer and more than 20,000 women for breast cancer. It's done daily, and if you want to come to the clinics, running every Monday for cancer clinics and for gynecology.
Where is that again?
Moi Teaching and Referral.
Okay.
And then, you know, in my clinic also, if anybody comes for screening, whether it's breast cancer or cervical screening, we can be able to offer that at Beacon Health Services. Then
what is Beacon Health Services?
Beacon Health Services is off Ngong Road, just across from the traffic police headquarters here in Nairobi, of 5th Avenue. So you come to 3rd floor, it's called Beacon Health Services, and we can be able to screen, we can be able to do early diagnosis and also give you multidisciplinary care of treatment.
Your contact.
Screening means how much do we pay?
So that one varies. As I said, that depends on the cancer. So there are various things, and that's why when people ask, how much will it cost me for my mom who has this cancer? The most important thing is, I would actually advise you do the consultation, and then during the consultation we can find what exactly do we need to screen. Because every screening is actually individualized, depending on your risk profile and what you need. As I said, if you come to me, you are 25 years old, and you tell me I want to screen for prostate cancer, and you don't have any history of family or prostate cancer in your family, I won't screen for prostate. I'll say that's not really a risk for you. The other thing for testicular, honestly, that's a very good question. So testicular cancer is one of the few cancers that are highly curable. Highly curable. So this kid who has a testicular mass needs to be seen urgently. So